but I've exchanged emails with a lot of you. My name is Michelle Garing, and I started at NAMI in January. So it's been a few months. The last 2.5 have been remote. So thank you for being here tonight. We're going to focus on mental health for children. And we've got 3 speakers, Angela Martin, Christine Jacobs, and Holly White. And I'll let you all introduce yourselves because I don't want to slaughter last names or the acronyms or where you're working. So we'll do that. The only couple items of housekeeping is we'll keep your mics, except for the speakers, largely muted throughout the presentation. At the end, we'll do Q&A, but if you think of a question during the presentation, feel free to type it in the chat boxes for us, and then we'll go through and make sure that everybody's questions are answered at the end. So if you think of something during a presentation and you don't want to forget it, feel free to type it in the chat box, and we'll make sure that we include that in the final discussion. So first up, we have Angela Martin. And if you'd like to take it away. And we will be recording this just so everybody knows, and we can always provide you with a copy as well.
So I'm Angela Martin, and I'd like to start by saying thank you so much for inviting me to participate in this. This is really fun for me. I love doing presentations. This is my first Zoom presentation, so be patient with me. I'm the clinical director at Kenosha Human Development Services. I've been working in the field of mental health since 1988. So I've been here for a really long time, and I started working with teenagers living in group homes and shelters. And I was a college student. I was going to be a journalist, and I got that job working with teens, and I just fell in love with social work and kids with problems. So that's and I'm also a parent, so I want to mention that too, that becoming a parent, before I was a parent, I worked for a long time in this field, and I was very resentful that people used to say, well, you don't have any kids, you don't know. And after I became a parent, I was like, there's a little bit of truth to that. There's a little bit of truth to that. So thank you very much for having me. I'm going to talk about children and mental health and just kind of have an overview. So children in the past used to be kind of seen as miniature adults, right? And they were limited only by their size. And adulthood happened pretty much just at puberty. Kids were seen as adults, and things have changed quite a bit. Kids are not adults. They're not little adults. And nowadays, we almost have an extended adolescence, right? That adulthood doesn't even start almost until you're in your 30s, it feels like sometimes now. But the way children experience the world, view the world, and process things are very different. So like they might see, we might see a box and they see a jet fighter. If that happens with adults, a lot of times we might look at that as a symptom of mental illness, right? So with kids, we want to be aware that there's a really wide range of normal. And I might say that a few times throughout this, that there's a really wide range of normal behaviors. So it's really important to kind of know the difference between kids and adults when we're looking at their ability to process emotions. Children are not as emotionally mature. A lot of times they're just figuring out what feelings are, right? They're not as able to make a good risk assessment. They're not as able to determine what is a good idea and what isn't a good idea because they just don't have the experience. Kids are also physically vulnerable. They're more vulnerable, and a lot of times that can really create a lot of different types of emotions and feelings. They don't have any political power. They're very reliant on adults. Any adults, pretty much, with some rare exceptions, have some ability to contribute to the choices that are made about them, and children oftentimes don't really have that. So that's always something to be aware of. They're very reliant on adults to take care of them, and not just of their physical selves, but politically to make sure that their needs are met. And kids have a lot of magical thinking, and a lot of times a childhood can be very intense. Kids can have a lot of intensity that adults don't have. And sometimes as adults, we reminisce a little bit on that and we kind of miss it, right? But also it can be very painful and difficult to be a child, the intensity of things that they experience. So I want to talk a little bit about developmental stage, because when we talk about disorders, it helps to understand a little bit about what is expected and what's normal in a child or in a person. So there are different tasks of childhood, and I'm sure, how many of you, most of you are professionals in the field, is that right? For the most part. So you probably took some human development class of some kind. You probably have learned a little bit about maybe Erik Erikson or Piaget, or my favorite child development theorist is Maria Montessori. I don't know if any of you are familiar with Maria Montessori, but she had a lot of really interesting theories about child development, which I really appreciate. So everyone, all human beings have tasks that to accomplish at different developmental stages, and I've kind of simplified them here. Infants and toddlers, their general tasks, from birth up into the age of maybe 4 or 5 or 6, your task is really to learn how to trust. And it's to learn that the world can be reliable and that we can receive love and that we can give love. And so we're learning about those things. We're learning how to bond with other people and how to start to explore the world and whether or not the world is safe. And during those years, we're also learning and we're starting to understand a sense of self. I don't know how many of you are parents, but it's really fun sometimes to watch babies learn that their foot is a part of them, right? Their hand is a part of them. Watching babies even just look at themselves in the mirror. And there's a stage of toddlerhood that Maria Montessori calls the all-powerful self. And that's the age when kids start to say, no, me, I do it, mine. And they start to tell you no, because they start to differentiate between themselves and you. And they start to feel a little bit of that independence. And part of the task of that age as well is to start expressing those feelings that you're just starting to develop. Watching young children start to develop emotions and feelings is something that's really fun and interesting too, and helping them learn how to express those. So those are the tasks that we learn when we're very young. And when we get to school age, we start to learn how to plan, how to engage with other people. We learn cooperation. We start to be able to understand abstract thought, and we're not as concrete anymore. We start to master things, right? At that age is when we usually start playing sports. We learn how to dribble a basketball, how to dribble a soccer ball. And we start to feel more independent from our families a little bit. We're still very dependent on our families. So those are the tasks of childhood. And many things can get in the way of successful accomplishment of those tasks, right? So different things such as mental health issues, children that experience mental health disorders can have disruption in those tasks. Kids who have experienced some kind of trauma, either a single traumatic event or complex trauma, also can experience disruptions in those tasks. So as we talk about mental health disorders and the development of mental health, we're looking at how well these tasks are accomplished for whatever reason, whether it's organic or environmental. So then we get to teenagers, and teenagers are almost like their own special chapter. I think they're the most studied group of among children, and they have a lot going on. So there's a good reason why they're so interesting. There's so many changes going on, and developmentally, teenagers are most like the all-powerful self stage that we talked about with toddlers. They're starting to figure out how to be independent. They're a little more self-centered than they maybe were 3 or 4 years ago. And they're kind of going back to an early life stage in a way. The brain activity in teenagers is very, very different than it is in other children. They're still growing their connections, but they're also starting a pruning process. So teenager brain development, it's very unique because the brain is starting to specialize. and the connections that are most used are getting stronger, and the connections that aren't used quite as much are starting to get pruned away. So that can also lead to a lot of different issues going on, and sometimes mental health problems will kind of really start to show themselves in the adolescent years, and the brain development that goes on with that. And also the disruptions in attachment and trust and social connections and their ability to process emotions and process stress. We might start to see some disorders in this age as well. So this really cracked me up as I was doing my research, this quote: "The adolescent brain is associated with sometimes elevated activation of reward relevant brain regions, whereas sensitivity to aversive stimuli may be attenuated." So that is really big fancy talk for they want what they want. And if they don't get it, they're not happy. So that made me laugh really hard because I have teenagers and that's my experience. So I was kind of cracking up about that. So how can we determine if there's a mental health disorder? We were just talking about normal development. So how can we figure out in the very wide range of normal, right? There's so many things that kids do that as adults, we look at it and we're kind of like, that's weird. Is that normal? Is that not normal? How can we tell if the child needs special help? So basically the definition of it is there a delay or disruption in developing age-appropriate thinking, behavior, social skills, or the ability to regulate emotions? So we have to look at where they fit on the scale of normal, okay? And does it cause distress? Does this problem, this disruption, or this delay cause distress to the child, not necessarily to the parent or to the adult? And does it disrupt functioning at home, in school, or in other situations? So that doesn't mean that if it doesn't distress the child, it's not a disorder. But if it doesn't cause a disruption and it doesn't distress the child, then sometimes we can look at behaviors and say, this is really distressing the parent, not the kid, right? So that may not be a disorder. It may be a pain issue that we want to work with. But if there are disruptions socially and academically or at school and in the home, even if it doesn't distress the child, then it would definitely fit in the category of a disorder. So here's some common disorders among children. A lot of children experience these things: anxiety, attention and impulse issues, autism spectrum disorders, eating disorders, I think, are disorders that often don't get enough attention. And often they're so well hidden, it's really difficult to find out what's going on with kids and their eating. Depression and mood disorders, as well as PTSD. Anybody have any questions? Am I going too fast? Okay. So the difference between, these disorders, a lot of adults have them too, right? Adults have anxiety, they have attention and impulse control problems, they have eating disorders, all of these things. And what's the difference between how it is expressed in adults versus kids? So with kids, many times, if they have anxiety or depression or PTSD, they may express it in body pain or discomfort. They're not necessarily going to be able to use the words sad or scared, but they may say, my stomach hurts, my head hurts. They may have a lot of sulking or irritability, just not wanting to communicate, but letting you know that there's something wrong through their behavior, right? Not really being cooperative with you. And it's almost like what I would call attention-seeking behavior. But then when you pay attention to them, they don't want it. A lot of times kids will say, you'll say, what's wrong with you? Or something's going on with you. I'm really concerned about you. And they'll just say, I'm just tired. I'm just tired. So that's a way that kids are expressing that what is really going on maybe is depression. Excessive or irrational worry. Sometimes kids who are having symptoms of anxiety, depression, PTSD, they may kind of latch onto something and not let it go. Like, I'm just afraid you're going to die, mommy. I'm afraid you're going to die. Well, I'm not going to die. Or, you don't want to lie, right? So you might say, well, everybody dies, but I'm not going to die soon. But really grabbing onto something and being inconsolable about it. And it's not even an irrational, sometimes it's an irrational worry, sometimes it's not. But it's just excessive, and it's a perseveration. There's a perseveration, right, of the worry. Sometimes kids get very clingy to the parent or caregiver, and they have to sit by them all the time. They're super, super attentive to their parent, or they refuse activities that normally would be fun for them. So that might be a difference in expression. Instead of being able to, they might not necessarily sleep all the time, because a lot of times parents control their sleep, right? It's time for bed, it's time to get up. We tell kids what to do. We tell them when to eat, we tell them to do their homework, not to do their homework. So these might be some differences in expression. And then a little bit more specifically, here's some warning signs. These are kind of more red flags too, that if a child has really persistent sadness more than a week or two, and sometimes there can be a triggering event that really makes sense that they would be sad, right? Like maybe their pet passed away or their grandparent died, but are they not able to get themselves out of it, right? Are they not able to experience any joy or excitement after a few weeks? Withdrawing from or avoiding all social interaction. I'm not going to read all these, you guys can read. But the other thing I want to mention is gaining weight. That's something that isn't always talked about. They talk about loss of appetite and losing weight, but a lot of times food is used as a negative coping strategy, and overeating is part of an eating disorder as well that is talked about less often. And then losing a skill or an ability. If a child is normally able to do something and they're not able to do it anymore, whether that's a developmental stage or something, that can be a sign that something's going on. If there's any backsliding in their abilities, that's something to definitely be a red flag and pay attention to. A lot of times kids they want to talk about death. Sometimes they want to talk about suicide. That doesn't necessarily mean that they have a mental health disorder. But if they perseverate on it, right? If they bring it up every time they're upset about something, they say, I'm just going to kill myself, or they seem obsessed with death or obsessed with suicide, that would be a warning sign. But a lot of times talking about death, asking questions about suicide is something that's very normal for kids, and it's part of their learning process. So I want to talk a little bit about schizophrenia, because schizophrenia is a disorder that does develop usually in later adolescence. And people who have some of these symptoms don't necessarily develop schizophrenia. But a lot of times when people who have had schizophrenia, when you start talking to them about their onset of symptoms, it started when they were kids. So this is something to be a little bit attentive to. It's not as common as the other disorders, but it's unusual, but it's something to be aware of. So a lot of times kids who are experiencing the onset of schizophrenia have negative symptoms. So negative symptoms are a lack of something, right? They don't make eye contact. They don't participate in discussions around the table. They avoid contact with people. They don't take care of their personal hygiene. So those would be red flags. Just a social withdrawal and cutting themselves off from things that they used to participate in. Sometimes people who are developing schizophrenia experience hallucinations. Hallucinations are something that is more common as a sign or a symptom in children than delusions are. Delusions are more common in adults, in adult onset, but sometimes kids can have delusions as well. And not every time that kids experience hallucinations is it necessarily schizophrenia, but that would be a sign of something that we would want to rule out. Disorganized thinking, which is usually, you can't tell what someone's thinking is unless they tell you. So it would be disorganized thought, disorganized speech, not being able to follow conversations, abnormal motor behavior. Their bodies don't always move as smoothly as they used to. A significant drop in achievement and a loss of interest in academics. Strange rituals around daily tasks. A lot of times it might revolve around food, or certain, like a bedtime routine or a morning routine. So I just wanted to talk about that a little bit, because it is, I have met a few kids who have been developing signs of schizophrenia and did in fact have schizophrenia diagnosis when they became adults. It's not very common, but it does happen. So if you have a kid that you're working with and you think that they are experiencing some of these warning signs, how do we get them help? The first thing is we definitely don't want to ignore them. We don't want to ignore the signs and symptoms. We don't want to just kind of brush it off and not worry about it. If it's things that are repetitive, that are really coming to our attention, it's okay to talk about it. It's okay to express concern, to talk to family members. You know, many times there's a family history of mental health disorders, so it's important to kind of find out more information from people and ask about it. Ask the teachers, ask coaches, other people who are involved in the child's life if they're experiencing any of these symptoms or if they see any of it as well. Keep data. So this is something that I always tell parents. If there's something you think you're going to talk to a doctor about, doctors are scientists and they want data. So what that means is write down symptoms, write down dates and times that you see things. It's really important that you don't go in for an assessment and say, he's just been acting weird, you know? So that's what I mean by data, like kind of keep things written down and keep a little bit of a record of what you're seeing so that when you go in, you can share useful information for an assessment. It's a good idea to start with the pediatrician. Sometimes some of these symptoms can be caused by physical issues. I was working with a kid who was very aggressive, who was very impulsive. He was poking other kids in the eye with pencils, and his parents got him glasses, and all of those behaviors stopped. I was like, wow, I thought we were going to have to put this kid somewhere, you know, and he couldn't see. And he didn't have any way to deal with it. And getting him glasses really helped a lot. So there's all kinds of things that can maybe get in the way of children being able to fit within the norm, right? So start with the pediatrician. And it's important, though, not always to end with the pediatrician. If you feel like your concerns are not taken seriously or you're not getting an answer through the pediatrician's office, then consult a specialist. Don't be afraid. A lot of times pediatricians will say, well, I can handle this or I can treat this disorder. And if you feel like you're not really getting what you need, it's okay to consult with a psychologist, you know, a pediatric psychologist or a child psychiatrist to get a more in-depth assessment. And advocate for your kid, right? Make sure that you don't just stop. Continue to advocate and try to get the answers that you're looking for. Treatment can be varied. Let's see here. Ooh, that's helpful. So since I'm a therapist, you know, I'm a big believer in therapy, of course. And the most important thing is finding a therapist that's a good fit for your family. That's number one. And number two, understanding that therapy with children is going to involve a caregiver. Parents should no therapist should ever see children without having parents involved in it on some level. That doesn't mean they have to be in every appointment, but especially anybody under the age of like 16. And I think even adolescents, you really need parents involved to a certain degree, more or less. And if kids are under 15 or 16, I think parents should be in quite a few of the sessions because it's always a family systems issue that needs to get addressed. Another treatment is skill development, just helping the kids figure out how to manage social situations. You know, sometimes kids just don't really have the skills that they need, especially if they are struggling with attention, struggling with anxiety. There is a lot of skill training that can help those symptoms. Support groups are really helpful. Support groups for parents and support groups for kids as well. I can't stress enough how school therapists, school social workers, they really are doing amazing things in schools these days to help kids. There's groups, there's one-on-one sessions, all kinds of things that can help kids deal with stuff. Medication, of course, is also a treatment modality that can be helpful. It's not the end. It's kind of, and it's not always necessary in every case, but it can be super helpful. Educating ourselves about a diagnosis, helping kids manage symptoms, because it really helps to take a recovery approach. to mental health disorders and understand that even if someone, this might be situational or it might be a long-term chronic condition. Many times people who are adults who have anxiety, who have a chronic depression, chronic anxiety, PTSD, it started when they were kids, and it's something that they're going to have to deal with. So looking at it as a recovery process really can be helpful. And I'm going to talk a little bit about beware the internet. If you go in and you Google, anxiety in children or bipolar disorder, whatever the diagnosis might be, a lot of times the first 20 or 30 things you're going to see are really negative. They really seem to have a lot of hopelessness. So be careful about which direction you point kids in or which direction you point family members in to do the research, because if you look at it from a recovery standpoint, there's a lot more hope out there. If you just look at it from what the internet has to offer in Google search, sometimes it can look really hopeless and scary. It's okay to interview treatment providers. You're never going to know until you talk to people, and it's okay to say this person isn't the right fit. Those are the important things to look at for treatment. And here's a list of resources. So I attached a bunch of articles that I looked at when I was creating this. And also in Kenosha, call Crisis for Support and encourage kids to call and family members to call as well, 24/7 for resources or just to talk. And then this is my joke slide that I put in there because, you never know what you're going to get, and you don't get this book. You get What to Expect When You're Expecting, Baby's First Years, What to Expect with Your Teenager. I'm in the What to Expect Early 20s version of that. So I attach my joke. So that's my presentation. Any questions?
I do have a question. That was so wonderful and helpful. Thank you. I have been out of the clinical counseling world for quite a while, and I know there are some other practitioners that are on here too. So I am working in schools, often with little kids, and I refer to pediatricians constantly. I refer to outside counseling providers all the time. And I also echo, finding a good fit. Don't give up just because you're having a hard time, with your initial assessment with a clinician. Are there options for them to have a shorter kind of interview like you were talking about session? Or do they, what do you guys do as far as providers? What kind of things do your clinics offer? Because that would be great information for me to have for them. And you don't have to jump right into an initial assessment. You could come for like a 15-minute, 20, whatever.
I'm going to see if anybody else wants to answer that question. Unmute, Holly.
Yeah. I think the issue of why people often, that's not necessarily something that gets set up, is because you have to, at least most clinics, when the person leaves your office, you have to have a diagnosis for them to bill. So like to have that, I don't know how the provider would get reimbursed for that.
So Christine, do you want to say something?
Yeah, switching to unmute. I want to put in a little plug for Triple P Parenting. It's the parenting program, which I know sometimes is a turnoff, that parents don't want parent education. But that model, it's brief and it's meant to address child behaviors. So potentially it could fit the need if the parent said, I'm having trouble with this one behavior. Even if there's a lot of behaviors, it'll be encouraged to focus on one at a time. And Triple P, I don't mean to make a plug for Children's, but there is a Children in Racine, through Children's, there's a Triple P provider who works throughout the community and delivers. It could be one session, it could be 2, 3, up to 4 sessions. So it's very brief treatment, and it's not necessarily that you're going to see, you don't have to see a therapist and get a diagnosis. So it's something and it could kind of dip their toe in the water too, that they would meet with somebody.
I do love Triple P, Christine. It's awesome. I recommend a lot of my parents, and you're right I really spin it to not so much be, it is a turnoff. They're a little bit defensive at first that it's like a parenting program, but I did just see, Julie, you sent the stuff that they're doing, those virtual workshops, which I think is amazing. I just sent something to my admin to put it up. But yeah, I think that that's a great resource. I'm happy. Are they gonna offer more than those initial workshops? Do we know? Because they're almost done.
If you go on children's website, my impression is they're pushing hard this virtual delivery model. So they're training people in it, and my belief would be that they want to keep using it. And since we're not tied necessarily geographically, even though there might be providers in Milwaukee or elsewhere, you could go onto children's.
Yeah, I think
Children's
that's a great
Hospital.
idea, and it's important to reinforce that if a child is having problems, it's a family issue. I mean, it's a parenting issue, and even if it's just, sometimes I try to spin it as, you know, yeah, your parenting is great for kids with certain needs. This child has some special needs, you know, and it's not necessarily a disability or anything, but this kid needs maybe a specialized parenting. But kind of to answer your question too, is if I were making an appointment with a therapist, and I have totally done this, I would say, can I interview you before I come in? Because I realize they're not going to want to spend an hour, you know what I mean? That's a lot to ask. But a phone interview, I think, is something that most therapists would agree to. And if you say, I really can't afford to spend, you know, however much money for an initial session every time I meet a therapist, and I really want to make sure this is a good fit, I think most therapists would at least agree to a phone interview. And if they don't, then you probably don't want to see them, because that's pretty rigid and inflexible. And if there's a disagreement over your bill, you're gonna not want to, you're gonna lose.
Yeah, I don't feel like we totally answered your question, Leah, did we? What do you think?
Sorry, you did. I just always like to be able to give them as much information as I can about what the process is going to be like and walking them through. And I know my only experience was in a hospital setting where we didn't really do that interviewing that much. But I think that with kids especially, and if we're contracting, you know, I was just wondering if, exactly what she described, I think that would be a great option for parents to just call and be able to say, can we have a brief discussion on the phone before I make that appointment? Because it is, you know, it's a commitment of time that they
Yep.
need to not back down on. So it's like,
And
we
money.
waited months and months to get into this appointment, and we spent hundreds of dollars, and then it just fizzles, and they're not comfortable. So then they give up on counseling altogether. So that's a really good suggestion that I can give to them. And if the provider can do it, they can. And if they can't, that's okay too. You know, like, it's just an option for them. So yes, you did. Thank you.
I would find it very surprising if there were a lot of people who were not willing to at least do a phone, you know, interview, because I think it's a little bit of an ethical issue too. You know, if you refuse that, I would be very surprised, but it's possible.
This is Aaron Munson. I think I'm the iPhone here, but I'll just add, you know, and this is even before now, I think it's pretty rare that my first phone call with, especially parents, but a lot of patients, adults too, it's pretty rare I get off the phone before 5-10 minutes, sometimes 15. And I'll always ask, you know, are you got any questions for me? And someone will ask very pointed questions, especially parents, about what kind of modality I use or treatment. And I'll answer as best I can. I always say, well, if I haven't met your kid yet, I can't say for sure. But, you know, we'll try to get as much detail as we can. So it's pretty rare that if I have an appointment at 2 o'clock, it's pretty rare I call a new person at 1:55 because I know it's not going to last 5 minutes. So then it kind of echoes that point that we're willing to answer those questions if they have them.
Well, and I think part of your job too is to educate parents on being good consumers of this service, you know, and giving them permission to do that. I mean, healthcare is the only place where you don't get to choose how much you pay. I was just talking about that because I actually went and got tested for COVID, and I called them first. I said, how much is this going to cost me? Because I just want to know. I mean, I don't want to get a $3,000 bill. And, you know, it's okay to ask those questions, but a lot of times in the medical field, they don't want to answer them. But I think therapists are a little bit more friendly. Yeah. Holly says, I love getting grilled. I'm glad they care so much to drill me. That's great. Exactly.
It's helpful for me too to think about things I can put together that are better tools for the parents, because you know that when we're referring, it's usually because there's been such tons of chaos at school or behaviors and things like that. So they're often in a really stressed out state. So even putting together like a list of helpful questions to ask a therapist would probably be something I could do for the parents. So maybe
Yeah.
I'll do that.
It's a great idea.
Great. Any other questions for Angela? Otherwise, if you think of something, we'll take some time at the end. But for now, we can move on to Christine.
Thank you.
All right.
Thank you. Yes, and Angela, I think you set me up very well, so this will dovetail nicely. Nicole, you've got
Yes.
my PowerPoint. Would you mind running that for me? That's it. Thank you. You can go ahead. Yeah. So I'm here to talk about. And I want to say thank you for having me here too. I'm here to talk. Sort of the next step is that was an overview of how can you tell what's going on with your child or what might be going on, and I will transition us into what do you do next. So how can you help support your child? So this is me. Oh, yes, go ahead. You can go to the next one. So yeah, I'm going to tell you about ways to support your child's mental wellness, how to communicate with your child or open that communication, and what you can do as a parent to help meet your child's needs. So who am I? I'm Christine Jacobs. I'm a child and family therapist with Children's Wisconsin. We recently rebranded from Children's Hospital. And I am school-based child and family therapist at Knapp Elementary. I've worked there about 4 years. Before that, I was in inpatient, child and adolescent inpatient psychiatry. And then before that, I was Child Protective Services. So I've had, it turns out, about 15 years experience working with children and families. And I didn't really stop and think about that number until now. So that was a little overwhelming. I think most people, when I would first talk about my role as school-based mental health, even a year or two ago, it wasn't as well known, but I think it's really growing. So most people know about school-based mental health. I will just add that Racine has an integrated model. So right now there are specific elementary schools that have a dedicated child and family therapist. But Racine Unified is also expanding the umbrella of school-based mental health to include coaching with teachers and principals. And then they also have a community mental health clinic for those schools that don't have the dedicated therapist. So let's jump right in. How to support your child with mental health needs. The first thing I put on this slide is show, don't tell. Humans are social animals. I think now in this time of COVID, we really realize how much we rely on other people just being a part of our world, even as adults, but especially for children. We look to one another, how to act, how to behave, even how to feel. You probably have heard about mirror neurons, where if a person is feeling a certain emotion, just another human can watch and feel that same feeling just from seeing another person express an emotion. So emotions are catching. Children especially, though, are modeling themselves on adults. Young children, you see it. They love to play dress up. They want to copy everything their big sister or brother does. They follow you around in the kitchen. So with that in mind, that yes, children are not just little adults fully formed with their own independent minds, as Angela mentioned. They are still forming themselves, and they're going to model around their environment, what they see. So what you do is going to be really powerful. In that, keeping that in mind, how you are managing your emotions is going to show them and teach them a lot about how that's done, what they can do. So think about what you're doing, how you're managing yourself, and also consider what happens if something feels like it's gotten out of control in your own life. Consider the resources. Do you need to reach out to somebody, a professional, for help? That's really powerful. Angela emphasized how family systems, something going on with the child is representative of a family dynamic, what's going on with the family. Even if it's just the child's behaviors, it's going to impact the whole family. It's going to add a level of stress to the whole household. So the parent is definitely a part of that umbrella, and maybe they need to go get their own support person, therapy. That is really powerful for kids because it normalizes the experience. If you're going to reach out to a professional for them and they see that it's already something that happens in their household, that is going to really send them the message that this is okay, this is positive, this is nothing to be ashamed of. So it really is good on its own that you'll set a tone for what do we do in our family if problems get outside of our family's control and we need some extra help. It's okay to ask and get help. Also, it'll be that mutual. They'll feel supported just in the mutuality. Even if you participate in your child's therapy, if they see you going to your own therapy, they feel like, oh, mom gets it, mom or dad gets it. They know what it's like. This is hard, it's not easy, but if mom's doing it, it must be okay. So there's a lot that can be said just in modeling that. Next, what are they going to look to? How do you maintain your mental wellness on a day-to-day basis? And communication and coping skills. Or you can go back to the communicate. Thank you. Perfect. Communicate, cope. Two simple but powerful proven techniques for managing emotions. I'll start with communicate. The brain, I'm not a doctor, but nowadays, brain science, neurobiology is really coming into popular consciousness so much more. We're all becoming much more educated on our own brains, which is kind of cool. So you may have heard, well, this is kind of a standard. The brain has two hemispheres, the right and left. The one side is the emotional side, and then the other side is logical. And yes, there really is separate functions in the brain like that. And there is science that's showing and proving that a balanced brain is really what feels most pleasant to us. When everyone can probably speak to, if you feel too emotional, if that side of your brain is taking over, it just doesn't feel good. Not to mention it can cause a lot of disruption. But then if the logical side is dominant and, too dominant, that can feel unpleasant too. So a balanced brain is really what we're striving for. So when we're feeling emotional, we turn to the rational side of our brain. That language center is in that logical linear side. So label your emotions, put a word to it, and that alone is powerful in tempering it, knocking it down a notch or two, soothing it, just by having a name for it. So it's surprising that even as adults, we go about our day and our feelings wash over us and we don't stop and notice, especially in our busy lives. We don't notice how we're feeling. So this is a tool, a skill that an adult can start to practice and model for their children and teach their children. These emotional coping skills, emotional regulation skills they're not taught. They're not, we're not necessarily born knowing how to regulate. So here's a feelings chart. A parent could do something like this at home with their child, post that's at home, rely on it, label your moods, even on a routine basis. When you wake up in the morning, once in the day, and at bedtime, track it, notice it. It will help the adult have awareness of this, but then it also teaches and shows a child how to go about doing that. keep in mind, if you're talking to your kids about your feelings, you don't overshare. Basically, you want to keep in mind their developmental age. So younger kids, yes, you do want to be honest and open when they see an obvious emotion on your face. Acknowledge it. Mom's feeling impatient from this long line. For an older teen, I had a hard day at work. I'm feeling overwhelmed. There is going to be a range, but it's a good modeling again that it says I can be open about my feelings. Next slide. You can go to the next slide. Perfect. What do we do though? We don't just want to stop there. All of us, again, this is in our popular consciousness too about self-care, coping. We're learning a lot more. We're hearing a lot more about taking time for oneself. So this is also important for the adult to do in their lives, and then it becomes a family practice or just routine. We all need to do things to manage our mood when we notice mom's impatient from waiting in line. Hey, let's see if there's a song on the radio, or maybe we can, count the number of people wearing red shirts in this, in this store. So you can use those skills, and by nature then showing your child what they are. So I want to just add one thing. With so much about self-care and taking time for ourselves, it's easy to sometimes get lost in what exactly is one's own personal coping skills. Sometimes things that like de-stress us are a little too numbing, and that's not necessarily doesn't feel good. So take time to really be aware of what helps you feel better. What do you notice after I do that activity? It improves my mood versus, oh, I just spent too much time online and now I feel yucky. You think it's going to help and it doesn't. So use your experience to be honest with yourself. Next slide. So now that we know the parent, you as a parent or the adult is able to model and set the tone for emotion regulation, what do you do? How do you get in touch with what's going on with your child? How to encourage communication? Next slide. The first tip is that I encourage you to create a space. Without it, again, busy lives, and we just get in routines and habits. A space, what I promote is 5 minutes a day. It's not too long, and you have to be realistic with yourself. If you say, oh, I'm going to spend one-on-one time with each of my children and my husband and my own personal self-care, you're going to run out of minutes. 5 minutes can be powerful. So it's not about the length and duration, it's about what you're doing with the time. So, and 5 minutes, you want to set it as a routine though. Sometimes we kind of save it all up like, oh, on the weekend we're going to have family time and only do stuff on Saturdays. There's a lot of days between Saturdays. So consider a way to make this fit into your life each and every day. So find a part of maybe the routine. Is it right before bed? Is it right before dinner? That you can start adding this in. And figure it out. A routine you can really stick to. Can you limit distractions? Can you occupy others in the home? That may mean the other kids get privilege, like some technology that they don't normally get, so that you can have one-on-one time with one child. And during this time, what are you going to do? You're going to have the child lead the activity. For younger kids, it might be a toy that they want to play with, playing with them. As the parent, since it's 5 minutes daily routine, you might give a menu of options and help them pick. Otherwise, the 5 minutes is going to be spent trying to figure out or find the toy to play with. For teens too, they're going to lead, and you're going to follow their lead in their conversation. So it's just a matter of saying to your child, introducing this, hey, we're going to start spending time together. I really want to spend this time with you. And we do 5 minutes before dinner, and we can do whatever you want, well, or within reason. Next slide. So now that you have the 5-minute routine, what are you going to do? You're going to foster a connection by active listening. Body language is important. I put on here reflections. That's simply where you repeat back what you hear your child say. Younger kids, it's a great way to tune into whatever your child's saying. So it really shows you're listening. We get so fast and so reactive, and with our own family members, we get relational dynamics that are habitual, like right away, you know? So after not very long, he says this, you say that, and it's like a script. You might as well just read the paper. What's your line? So reflections will slow that down. It'll take time to really hear what your child is saying. So yeah, we use it in therapy, and it's great for parents to try. Summarizations, that'd be where if you know your teen is telling you all about what's going on, you summarize so that you really get what they said. And open-ended questions can be great. Open-ended are the not yes or no. It's the who, what, where, when, why kind of questions. Not that you want to probe, but older kids and teens, if you're having a conversation with them, they might appreciate that you're following their conversation by asking some questions. Next slide. Being supportive. So you're there tuning into them by following their lead, whether you're playing or talking, and reflecting. It shows that you are there with them in what they're doing and there with them in what they are saying. But to take it up a level, how can you be especially supportive? Think about your child's perspective. Angela, again, did a great job telling us that kids are in a different position than adults in this world. Adults run the world. So kids are, by nature, just at, they are submissive to adults. So they often feel in child-adult interactions, they feel like there's an authority over them. So even neutral comments can come across as a criticism or a right or wrong answer. So you don't have to ask questions during this time. You can just be there, sit, and reflect what your child's saying. And now's not the time to give advice or weigh on what they say because it's 5 minutes. So during this 5 minutes, even though your mind may be churning with what the child told you, save it. There'll be plenty of other time to say, hey, by the way, when we talked about this the other day, I was thinking about it. Can I talk to you more about it? So you can do it on your own agenda later, but during this time, figure out a way to just let that go. Stay positive. Yeah. And then labeled praise. We all like to hear good words and kind words about ourselves. In the world today, there is so much negativity and contention, people against each other, that we humans can absorb that even when it's not directed at us. So having something positive directed at oneself, at your child, can really overcome some of that negativity that happens in the world. A labeled praise is meaning be as specific as possible what you like your child doing. And praise doesn't expire. So if it was, hey, this morning when I saw you, put your dishes in the dishwasher, thank you. That was really great. So you can add it even if you're checking in with your child later today. Next slide. Real quick troubleshooting. What if your teen, especially for teens, what if your teen thinks this is coming out of nowhere? Here my parent is coming into my business. Teens, it's developmentally appropriate for them to want to separate from family, spend more time with friends, be more independent. But on the other hand, in my work with teens, they crave adult attention. They crave still that connection with their parent, even if they can't ask for it. So by setting this routine within a family, it will tell your child that you really do want to be there for them. They might test you. They might not make anything of the 5-minute time. They may say, they might just sit there in silence, and that's okay. This is their time. So by letting them lead, if they want to be quiet, you can do that. Yeah, that might right there blow their mind. You're coming to just be with them and you have no agenda. You've got nothing to say to them. So yes, that is totally okay. I bet after after a few sessions like that, they'll just start filling in the silence and opening up. Okay, next slide. How to leverage your parenting skills is what I call this one, and I only put one bullet point. Get support. And that's there for a reason. Next slide. Yes, we all got one of these, but since nobody has a DVD player anymore, we can't use the baby user manual. Nothing is on DVD. So you had to throw that away. Oh, or we didn't get one of those. Yeah. Even, it's kind of funny that Angela mentioned that too. No child comes with an instruction manual. Even those how-to baby books, every child is unique. A parent can very easily open it up and say, this isn't my child. Parenting nowadays is very isolating. We don't realize how over the last century we've moved away from more of a collective model of parenting with an extended family or support networks. And now the nuclear family is king. It's all about having your own little family, and you keep people out. But when it comes to parenting, that's so hard. It puts all the pressure on the parent. And there is no expectation that the parent would know it all. How do you know what you're doing unless you're just learning as you go along? So you're forced to learn through trial and error. And on top of it, there's no one way to parent. So next slide. What do? You're going to get support. It's going to vary for everybody. What's right for you? I put on here balcony person or basement person. So you might go to support in real life. You might have people in your life that you can look to, but you want someone who's going to raise you up, like on a balcony where you can see everything and make you feel good, not bring you down to the basement where you don't feel good and you talk to that person and you always feel a little lower, a little stuck. So make sure if you're talking to a person about your child and parenting needs that it's the right kind of person. You're feeling supported. I did put online. Yes, there's a lot of information out there, a lot of resources, but I didn't think of this, but Angela made a good point that you got to be cautious. So that's why I still love books and encourage, that's a starting point, is that you can look online for actual books, and then you might know the names of certain authors or professionals that you can then research more online. So yeah, there's a lot of useful parenting books out there. And then professional help, no question, is that sometimes parents might just go to therapy for themselves for parenting support. That is a great way to use professional help, is that you can have a designated, that's your goal. You will go in to your professional and say, I just need help right now with this new challenging behavior that my child's exhibiting that I've never dealt with before. Can you help me in these sessions while I take my child to get help for themselves and participate in their treatment? It will really offer what's great about that is it can designate a time and space to worry about the child's problem. Sometimes if a child's having a problem, it takes over a parent's whole life. They can't stop thinking about it. But if they get hooked up with, a therapist, my appointment's on Wednesday at 4 o'clock, I can kind of save everything up and know that I can let it out then. And also it will feel like you're not burying your head in the sand. I am opening up about it. It can be so shaming when a child has a problem and parents sometimes see other kids and think, why isn't that my child? Why isn't that my family? So it doesn't have to be shaming. I think realistically every family is dealing with something. Just because you don't know it doesn't mean it's not there. So yeah, wraps it up. That's kind of in a nutshell what I've got of how to model and teach skills, and then open up communication, and then how parents can get what they need. Thank you, Nicole, for being my PowerPoint conductor.
I tried my best.
Yes, I am not very adept at. I've never had. You were my first time of my PowerPoint conductor, so I've never had someone do it for me. So I'm sorry if I wasn't as smooth.
No, we got through it.
Yeah.
Great, thanks, Christine. I just had a quick, not really a question, but sort of a thanks for the awareness as far as doing what a parent feels right is for them. I think especially now in times of COVID when so many resources are going online, and we see people expressing an interest or a preference in that mode. So that's kind of taught me the importance of that and the importance of collaborating to make sure that people are taken care of when they need remote services too. Thanks.
Christine, just a quick question for you. Before you mentioned Triple P parenting, and for those parents out there that are going to be listening to the recording, can you talk a little bit about just the program itself and kind of like its component pieces and how parents can kind of the takeaways for parents doing the Triple P program?
Oh, you kind of caught me off guard. So I wish I had like really good talking points, but I will give my experience. And if it doesn't sound as smooth, I apologize. But Triple P parenting is a researched, evidence-based parenting support education program. It's international. It's used throughout the world, developed in Australia, actually. And Triple P providers can be therapists, they can be professionals, but they can also be parent educators. It can be disseminated a lot of different ways. But for a Triple P provider, a trained Triple P provider could meet with the parents and deliver like a structured parenting education and resources, all centered around positive parenting. So it, again, is evidence-based parenting techniques. Even though there's not one size fits all parenting, the research, the information you'd get from a Triple P program is all going to be based on research and methods that help. And then there's it's really meant to be short-term delivery mode in a variety of settings. So it could be in the community. Sometimes I think it might be in-home, not now obviously, but I guess in a typical environment, there's no one place that it can happen. So there's no specific type of person who can get trained in this, and there's no one place it can be delivered. But what the parent can expect is to get evidence-based information and knowledge to support a variety of child behaviors. The primary Triple P is for, I think, 12 and under, but they are expanding it for teenagers. So certain Triple P providers may have the training for teenagers. The parent would meet with the provider one-on-one. It could be 1 to 4 sessions. So it really could be very brief, that the provider and the parent meet to talk about the specific behavior that's a problem, and then the parent could leave with some information and a plan of how they are going to feel empowered to address that in their own home. If they had more than one session, they could follow up with the provider, check in on how the progress is going, and tweak their plan. And then if they get to the end of 4 sessions and they feel like they've got more child behavior challenges, they can meet again with the provider. And I'll add one more thing. Sorry, it looked like I was about to be done. But Triple P also has seminars where they present a more generalized body of information, the same positive parenting information and parenting education in a seminar format where it's a large group and it's not necessarily going to be specifically one child's behavior, more of an overview of parenting skills and challenging child behaviors. And there's a lot of new seminars that Triple P is coming out with on different topics.
I can say too, guys, just from my experience, I've had experience with both English and Spanish speaking families utilizing Triple P in Racine. The provider is bilingual. She's met with them at home, at school, at Starbucks. Like, she will meet with them wherever it works for them at all different times. And I have had nothing but positive reviews from Triple P. So love to utilize that program.
Okay. Any other questions? Thanks, everyone. This is kind of taking on a nice sort of roundtable format. So next we will have Holly.
Okay, can you guys hear me?
Yeah.
Okay, great. So my name's Holly White. I'm the project coordinator for the Healthier Wisconsin Partnership Program. If you've seen anything from me, it would either say HWPP or AHW, is Advancing a Healthier Wisconsin. So I coordinate a grant. You can see the state of Wisconsin here. There are 10 funded communities around the state by the Medical College of Wisconsin to do something around behavioral health. Obviously, you can see there's more than 10 counties. It's because some of the grants span across multiple counties. So these communities are working on a variety of different things, and we're just going real high level, so bear with me. I am going to put at the end my information in the chat as well, if you want more information about this project, because this is obviously a very, very condensed version of it. I'd be happy to go into more detail with you. Oh, sorry, to back up a little bit. So I've been with PSG for 7 years now. After I did a career switch, I worked in federal law enforcement in the Death Investigators Office in Milwaukee. So I kind of switched careers, went back. So now I'm a social worker by day and a therapist by night. Some people see my name in all different places, so that's why I'm kind of a workaholic. But anyway, so all of these different counties are working on different projects to kind of attack the needs of behavioral health services depending on the county. And so what happened was Racine decided to look at our 4K through 5th graders in particular, because a lot of the data that we had from like the 4K level was showing that overall, using that teaching strategies Gould assessment that a lot of the 4K sites are using, children overall were meeting milestones, emotional milestones. About 85% of them were where they needed to be developmentally. And then the next assessment after that was the Youth Risk Behavior Survey that doesn't get administered till 7th grade. And basically using some of the PHQ-9 questions that a therapist used to assess depression and anxiety, those are essentially on this survey, kind of being a red flag that around a quarter of Racine Unified students could meet the criteria for depression. So we wanted to see what was happening in that middle space, because as far as Racine specific data, we didn't really have much. So when this project first started, a social emotional learning assessment was implemented in Racine Unified. So particularly if you're with the elementary schools, you've probably seen me 100 times and sick of hearing about this, so I'm sorry. But we wanted to look at social emotional data from 4K to 5th graders and kind of honing in on the indicator being improved emotional regulation and social awareness on the panorama assessment that Racine Unified administers. And so kind of after that, again, very high level. So if you want to talk more, please let me know. But we identified these 4 key strategies to improve these social and emotional indicators, and understanding that I think a lot of times people use social, emotional, and mental health interchangeably. But really what I'm talking about is these are basic universal interventions for all children. This isn't just identifying kids that maybe have a higher level of need. So we obviously know with kids at that age, parents play a key role. So we wanted to increase opportunities for parents to learn about social and emotional skills, because it's been kind of a new buzzword. People don't exactly know what it is. So a lot of times not only explaining it, but kind of modeling and showing parents what that looks like. So how do we understand emotions? How do we manage our emotions? How do we get back up after we have, you know, something didn't go our way, all of those sorts of things. And so we want to assist parents with that, knowing that that's not just an innate skill that everyone is born with, which I think has been kind of the same kind of theme through everybody's presentation today. And then strategies 2 and 3, we work very closely with Racine Unified to work on adult social and emotional skills at the school level, and also what are we intentionally doing with kids in the school day and after the school day that build social and emotional skills. And then the last one is what I'm going to kind of focus on for you guys today, is to improve coordination and pathways to mental health services. So one of the things that we found in the early years of this project, we're in year 4 right now out of 8. And initially, the perception of a lot of people in the community was that there weren't mental health providers. We don't know where to find them. We call places and they're out of business, or I call someone and they don't take my insurance, or the bus route's not over there, or whatever. There was a lot of issues of access. So what we are attempting to do with the website, I'm going to show you guys that I know some of you have already seen, but it's simply to do that, is to improve access to mental health services, to try to make it as easy for people as possible, rather than when they're at a point where they have some mental health concerns and really need some assistance. That's not usually a time I want to pick up the phone and call 14 people and explain my situation and everything else. It's not exactly a fun time. So the less frustrating that we can make this for people, the more that we're hoping that they'll be able to find effective treatment in a more timely manner. So we'll get into that as well. This I'm going to put in the comments as well. This is our kind of our side website through Racine County. Racine County Human Services is our fiscal agent. So on here, there are tons of resources that are connected to social and emotional learning. Some more detail of, again, what it is, that it's really just the process in which children are managing their feelings among all the other areas we talk about, like social awareness, grit, emotional regulation, growth mindset. Those are all things we want to see in all of our kids. So if you want more resources on social emotional learning, I will put this in the chat so you have that. Kind of the next piece. So just, I'm going to give you guys a couple of strategies that are used in intentionally building SEL kids, or SEL skills in kids, again, as a universal thing. So it's not like we're saying we're just targeting this tier 2 as an intervention, or Bobby keeps getting kicked out of class, so he needs to do this. These are just things that we want all of our kids to be familiar with. So some of the things that parents can do, I know this recording is going to go out for them, that parents can do to later prevent more significant mental health issues, or to at least help develop the skills to be able to have conversations around these things. One thing you can do is repetitive regulatory activities. So alongside, so we, in the last presentation, mirror neurons came up. So again, it's just this modeling. A lot of times what we see is maybe how we respond or how we feel. Another thing also is just kind of doing a repetitive regulatory activity, something calming that the parent and the child can do together, whether that's listening to rain music, or it's watching a Go Noodle video, or whatever, something that you're doing with your child that they're learning by doing it, but they're also learning by seeing you do it. I have had clients that I work with in the therapy realm who think meditation, or they hear mindfulness and they're like, oh God, please don't give me that hippie stuff right now. But then I actually will do it with them, and then it doesn't seem so goofy anymore. So like I turn my chair, you know, at first the other way, so I'm not looking at them, and you kind of build up to it. I think a lot of times the words that we use turn people off, but the practice itself can be really good if you need to just call it something else. Building relationships with caring adults, obviously we know that that's effective for everything, but when we also have strong relationships with adults who appropriately show their emotions, so like my counselor at school, or the after school gym room, or whatever, the more that those people in the child's life are showing how to deal with emotions, that it is okay to cry and it's okay to articulate these feelings, and these are all things that are okay, typically then it's easier for kids to do it too, because it doesn't have this like kibosh or this stigma around it. Reading to your child. So again, I think a lot of people know, okay, reading to your kid is good, and I think they think about it from more of like a literacy or an academic point of view, but really it is another regulatory routine activity that can be predictable, that can be impactful, not only for academics, but for emotion. So like when you're reading a book with your kid and Billy steals Susie's socks, okay, well, how do you think that that made them feel? Or just having conversations like that at an early age can be really helpful for building those skills. And then just daily routines and structure. A lot of times if like not only my basic needs not being met, so like if I mean, we know this, right? If I'm starving or I don't have electricity or whatever, I'm not necessarily in the space to learn. Kind of the same thing, that level of structure also allows for that additional level of learning. So, and I'm gonna show you this website, which I'll also put this in the chat. You'll see on here that this is a longer name, but the link is just RacineCountyFamilyResources.com. So again, I'll put that in the chat. I was just going to, for time's sake, I'm just gonna show you one feature of this because it's a feature that can be very well utilized in Kenosha and Racine versus the resources. So like tangible resources in Racine, like a food pantry or tax assistance or things like that. It's going to be specific to Racine, just like the looking for a behavioral health provider here is also specific to Racine. So if you do a lot of work in Racine and you are not familiar with this website, please let's connect so that I can show you this in more detail. But the one thing I want to show you guys quick that anyone can utilize, this website, we contracted with a company that does government websites all around the country. And so if you look on here, this library tab has a ton of resources that are nationally reviewed and evidence-based and peer-reviewed so that anyone can use these. These are the same tabs in any community around the country that uses this same platform called Trilogy. But you can look, so there's information on medication, different interactive tools and videos. There's some really good ones on substance use, how to talk to your kids about that, looking at different symptoms, quick mental health screener, all of that kind of stuff. I'm just going to show you. Oh, okay. So not only can you just search for any health topic, physical or mental health, it's all on this website. And like I said, there's over 30,000 articles that these are nationally reviewed for all of the websites around the country. So again, it's not just mental health, it's also physical health. So let's just say I want to click this, or again, I could just search for whatever topic I was interested in. And you're going to get tons of easy to read. So not only are they peer reviewed, they are much more digestible than if you're like looking around on WebMD. So there's lots of information about different drugs, some interactive tools that people can use. How do I have a conversation with my doctor about this? How do I have a conversation with my parent? What should I do if I think someone's drinking too much? All that kind of stuff. So just a plethora of resources that you can use. And there's also like forms and plans and parenting worksheets and things in here as well that parents could use, or if you're a provider, I've used a couple on here. There's one, it was called Creating Boundaries, and it was just a very linear, very clear thing I was working with, someone who was a little rigid, and that was really helpful. So that's it in a nutshell. There's tons of other capacities. It translates into a ton of different languages that are not coming up right now, but over 50 languages. And there's plenty of other ways to utilize this and other features of this, but like I said, for time's sake, if you would like to do like a webinar with me, just let me know. That's it.
Great. Thanks, Holly.
No
Yeah, we
problem.
should
Thank you.
follow up with you with maybe doing a webinar together, because I
Yeah.
know we've seen this at NAMI and there could be a lot of good crossover with the information.
Yeah, let's do it.
Any other questions? Okay, well, thanks for being here. Nicole, could I ask you, since you're facilitating next week, to kind of lead us into just a really brief overview of next week's topics?
Yeah, next week's topic is going to be peer support and what we've been facing and the challenges we've had in receiving peer support, the challenges providers have had in, giving that support that's needed for people out there with mental illness, and just cover some of those topics. So we hope to see some of you guys next week, same time, same place. Hopefully I'll have a face next week.
I have one question for Holly. You said that you guys are working on adult social and emotional skills in schools. Tell me, just, are you working with the teachers? Are you?
Yeah, so
how's that going?
It's very macro level. So we basically work to support Racine Unified. I mean, at the end of the day, Racine Unified is gonna take on what they can or can't do, So right now it's very initial. So one thing we're looking at is the climate surveys that all staff take. And looking at where some areas of deficits, and then we usually will say, okay, these are some recommendations we have based off of, we have academic partners and researchers from MCW. We'll say these are 3 things other communities have done to intentionally improve blank. Some require money, most of them do, some not as much. And then the other piece of that is we look at because right now there still is, with a lot of people, there's not even this awareness of what we're talking about. So it's trying to have trainings available that are very basic level and hopefully through time, like an intermediate level and then more advanced and working people's way up. But I think we're still a lot in the awareness piece, I guess.
We did in Zion School District for over 10 years. We did social and emotional learning. We did use the teaching family model, but we adapted it to work with the teachers there, and it was a very interesting experience. It was going really well. We'll talk about it some other time if you want.
Yeah, for sure. I'd love that. Yeah. Yeah, a lot of the people who are, the big buy-in people to social emotional learning are all on this call, right, Leah?
Yes, totally. I was excited about what you were just talking about. And, I have to say that I've been obviously, fulfilling my PD hours as an educator in my house instead of in the school building. And I sent Andrea a text today telling her that I keep taking these webinars and they're great. But it just really brings to light how far ahead Racine Unified is compared to a lot of other school districts in acknowledging the importance of social emotional learning and having mechanisms in place already, where other places are freaking out. Like, we need to teach them mindfulness when they come back. We need to teach teachers about trauma-informed care. And I'm like, we've been doing that for years, and it feels really good to have that foundation, because it's still going to be hard, but we have a good start.
Yeah, I think that I think that's great, because I told Andrea once, I went to an international conference in Baltimore, and I was one of 3 people in this room of 500 who had, that their school district had an SEL assessment, had 2 or more curriculum pieces they were paying for with social emotional learning out of that entire room. I'm like, well, I thought we were behind, but I guess we're like way ahead.
No, and all the research is from the 70s.
Right.
Like,
why is it just,
It just blows my mind. Really, this is like, it's not like kids having emotions or people having emotions is new, right? So like, what have we been doing this whole time? Like,
well, I had no idea how little preparation teachers get. I mean, teachers do not get prepared to deal with, I mean, they get a lot of preparation to deal with classrooms and to teach and all
Right.
that. But
just like the human being aspect, right? Like
Yeah.
people have emotions, and I mean,
and you have
know it's a-
emotions and it affects the kids.
well, right. You're right. Yeah. I mean, it just, I feel like for me, not to hold everybody up too long, but at a younger age, I feel like I've been pretty emotionally mature, like really in tune with my emotions. I don't feel like it took me as long as it did some of my peers, and even with my family and things like that. And it just, I mean, that's why I got into this work, right? But I just, the longer I work with NAMI and other organizations, the more I'm just like, this is common sense to me. And I know it's not for everybody, but it just blows my mind. But I was really happy and pleasantly surprised when I started doing presentations with Nicole in the schools, how many, the teachers reach out to us, how many of the teachers were so open about it and so like prepared and like emotionally mature and had so much knowledge about it and were huge advocates about it. It was just really encouraging, because it's like, when you do this work, you can feel so alone, like you're fighting an uphill battle, right?
Yeah. Thirsty for more too, right?
Yeah,
Thirsty
well,
for
right.
more
Like,
resources and more.
you have to keep pushing forward and being innovative, and so it just, I'm glad that we had this, because it's just really encouraging that we're doing the good work. So
Speaking of resources, I don't know how many of you guys know this already, but we are offering our teen group. Thank you,
yes.
Christine. Through Zoom now, and it's going to be offered the first and third Wednesday of every month at 4, right, ladies?
Yes. Yep.
At 4 p.m. So please share that with anyone you think might be interested in that information.
Yeah, and they can, here, I'll put my email in the chat. They can, we're having them mainly email me, just because Nicole obviously has a lot on her plate too. So, or Christine too, it's up to you, but you guys can email, any teachers, any parents can email me. So far I haven't had anybody email me yet. We've had a couple people message, but not get back to us after that. So, and we're hoping, we could do this even after all this kind of calms down, keeping it virtually, just so it's easier access for kids too. So thanks Nicole for plugging that, because it's obviously really important, especially right now. So
great. And I'll keep the group posted too. So when we do Ending the Silence or ETS in the schools, like Allison mentioned, we get good reception. We've had to put it on hiatus right now because of C-19, but we had a NAMI Wisconsin Zoom today with all the affiliates, and the NAMI Wisconsin's flagship in Madison is in the very first stages of putting together some ETS NAMI sanctioned videos that we can share in the meantime with schools, teachers, students, parents, until we can go back in person. So once I get information, we can share it with the group if that's something that would be helpful.
That's gonna be it's just so important, because I just thinking back, when Angela was talking, when Holly was talking, when Christine was talking,